can be hard to see children who are hurt. It can be hard when the systems that we depend on to take care of kids don't necessarily work in ways that we find ideal. I'm an associate professor of pediatrics. I'm the director of healthcare services for the Kempe Center, and I direct the child protection team. And in that role, I also have some other administrative responsibilities. I help run the Care Network program that we created about 3 years ago, and I help with the medical direction of the Pediatric Sex Assault Nurse Examiner program. I'm so honored to receive this award. When I look at all the list of prior awardees, it's just really profound, and I'm just so thrilled to even be mentioned in the same breath as some of the people who've had this award in the past.
The Child Protection Team is a multidisciplinary medical-based team where when providers or clinicians in the community or parents, law enforcement, social services have a concern about the possibility of abuse or neglect, our team is able to do a medical evaluation to help make a medical diagnosis of has abuse occurred or has it not occurred or is it indeterminate.
My team members are really they're sort of the core of what I do. We depend on each other, and this work isn't always easy, and so having a supportive team is super important.
This award is really important, and it just shows us in the community of who she is. She's a community leader. She's an expert in what she does.
Antonia would probably tell you, Dr. Chiesa would tell you that she's first a doctor, right? That she is first focused on providing good care to kids and families. And also, I would say her role as a mother, as a partner. I mean, I've been able to see her grow as she's raised a family, that I see her really committed to her role outside of work as well as her role in work. And that's sometimes hard to find that balance.
She's very conscientious and slow in her thoughts. She takes time to really understand the situation and try to put herself in the perspective of her patients and their families.
I've been so influenced by the culture, the people, and the history of the center that it's really, really meaningful for me to be honored for the work that we've done together.
I think her approach to advocacy in families and with our community agencies is a very holistic and comprehensive approach that goes beyond just the medical aspects of a child and the family that present, but really a lot of the systemic things that impact families that result in child maltreatment.
Child abuse is not one person's issue. It's not something that's wrong with the family. Oftentimes what brings families to really bad places in their lives is related to things beyond their control.
I still learn from her every time we connect about a patient. There isn't a day that doesn't go by that I don't think, I'm so proud of my colleague, and I'm so proud that I still get to work with her.
She wants to teach and she wants to share her knowledge so that she brings everybody up with her.
How well she's known by many in our community and the community agencies that we work with around the state and around our region. She's an expert liaison and a resource.
She is able to be serious, and yet she's able to laugh with us as a team when we sit down at our center table in our office and have birthday cake with one another. She's relatable, and that's really nice to be able to have.
This is my professional home. I like to joke that I've really never had another job. This is the only real job I've ever known. I sort of grew up at Children's and trained and joined the Kempe family.